Hello, good evening everyone. My name is Major Radhika and I am a retired nursing officer from Indian Army. Currently I am working as a nurse educator with Penmic Health Staffing Services. I have trained many nurses for international interview process and I have realized these are the most 5 common mistakes which nurses makes during an interview. So today we will talk about those 5 common mistakes. Number 1 is poor introduction. Poor introduction when you don't introduce properly. First impression is definitely very important. So in your introduction, please make sure that you talk about your qualification, you talk about your experience, your overall experience, and then you talk about your department, in all which department you have the experience, and yes, currently in which department you are working and from how many years you are working in that department. So these things are important in introduction. Number 2, poor clinical knowledge or poor clinical scenarios knowledge. When you don't give proper answer for the scenario based questions, this is most common mistake which nurses makes. Why? Because they try to give bookish answer and they try to give answer which is good in books and all these things, but you forget, see, nursing is totally a practical subject. So whatever you are doing on a daily basis in practical in your nursing station, that you have to tell, you have to share your experience. Let's say, okay, what will you do if the patient BP is low? I will inform to the doctor, I will give IV fluid. This is the wrong answer. See, the intervention can be right, but the technique is wrong. What you have to do here, you have to give a structured answer. Assessment, basic intervention, inform and document. So this is the structured answer, because interviewers don't want the bookish answer. They want right answer with good clinical knowledge. Number 3 mistake, weak communication and confidence. See, if you have so many years of experience, you are practically very good, but if you lack confidence and if you lack communication skills, you will definitely get rejected, right? So you have to work on it. Hesitation, low voice, these all are signs of low confidence. So simple English is okay. You don't have to be very fluent in English. Fluency is not important, but yes, clarity and confidence is very important for getting selected in an interview. Number 4, not understanding the question properly and answering it immediately. That is also very common mistake which nurses make when they don't listen to the question properly. They just listen to it half-heartedly and they try to give answer immediately. That is very common mistake. Why you should avoid it? Because you see, you may think that you know the answer and you will start immediately giving answer, but you will not be able to navigate those answers to the end point. So that is why it is very important to understand the question properly. Take some time, 2 seconds, 3 seconds, and then structure that answer in your mind and then give your answer. Because the late answer is good than wrong answer. Now the last mistake, when you give interview without proper preparation. See, you may have a good confidence, you may have a good communication skills, you may also have a good experience, but still you can get rejected in an interview if you don't practice basic questions, you don't practice your intro, you don't practice HR round, you don't practice scenario based questions. So this is also one of the most common mistakes which mostly experienced nurses makes. So we at Dynamic Academy, we take care of all these things, and join our Dynamic Academy for more such informative sessions. Thank you so much.